this video, I want to talk to you about one of the most common questions that we get asked in clinic, which is, should I use hot treatment or should I use cold treatment?
Don't forget, if you like our content and you want to see more from us and more videos to help with your health and well-being, make sure you subscribe to our channel and hit the bell so that we can notify you as soon as we launch any new content.
Well, first of all, before I answer this question, the answer really is vital in us understanding why we're using those treatments. What are the purposes that we're looking to do? So when we're using hot treatment, what we're looking to do is encourage a blood supply to warm tissue up to make it more pliable, more ready for competition. But one of the downsides to that is if there is any inflammation, we would be encouraging a bleed to the area. So we could actually encourage inflammation if that was present. So when we're using cold treatment, well, there's two main benefits to this. What we're looking to do with cold treatment is to use it as a natural anti-inflammatory to reduce inflammation, and also it works nicely as a painkiller as well. So firstly, when will we use heat? Well, we know that what we're looking to do when we're using heat is to encourage a blood supply or to increase flexibility or pliability of tissue. So heat works very well on tight muscles, and in particular pre-competition, pre-exercise. If we feel particularly tight in an area, then using a heat supply can help to increase the flexibility of the tissue and increase the blood supply and warm the area. So generally speaking, what we want to be doing is using heat before competition, before exercise, to give us those benefits. Now, how do we apply heat? Well, we can apply heat through a variety of ways. I like the use of something like a hot water bottle, and I would tend to encourage using that for 5 to 10 minutes. But we have other things like deep heat or creams that can create a heat response in the tissue that can encourage a blood supply. But a reminder that it will increase inflammation. So I don't tend to use heat around anywhere where I would suspect there could be an inflammatory response. But in truth, pre-competition, if we think there's already an inflammatory response, we probably shouldn't be doing that competition or exercise. So cold treatment. Well, cold works fantastically well to reduce inflammation. Now, it can quite rightly be argued that we need inflammation, that inflammation is our body looking to heal itself or to heal any damage. So why do we want to stop inflammation? And there is contradictory research around there. There will be people that believe very strongly in the effects of cold, and there are other people who perhaps feel that we shouldn't use cold on the treatment in order to prevent inflammation. However, I still believe in using cold, using ice in order to reduce inflammation and ultimately reduce pain and promote recovery. I think although there is research against this, we still, in even top level sport, if we see an acute injury sustained, the first thing they do is put ice on it. And the reason for this is that the body will release a lot of an inflammatory response. A large amount of inflammation will happen. And in fact, if anything, it probably over responds to a situation. So what we want to do is calm that down, is we want to calm that inflammatory response so that we're just getting the amount that we need and we're not being left with excess inflammation. So if we are suffering inflammation, then actually ice works very well. How do we apply ice? Well, when it comes to applying ice, again, we have a variety of means. There's very high-tech means. You have things that we term cryotherapy, and you can go into a chamber to experience that ice effect, or we have cuffs where we can pump water and freeze that water into them, and devices like Game Readies, which are very high-end devices to apply cryotherapy. But also, what we're looking to do is just to cool the area, cool the joint or muscle that we feel there's an inflammatory response. So the good old-fashioned bag of peas can also work very well. And what we want to do is to apply this for 5 to 10 minutes. And particularly in the early stages, in the acute phase of injury, being the first 72 hours, we'd look to do that repeatedly. So 5 to 10 minute intervals, but then an hour later, you might look to repeat that and over again. A reminder though that ice can burn. So what we don't want to do is take ice straight from the freezer and apply it directly to the skin, because that can create a burning effect. We always want to at least wash this ice and potentially put another layer to act as a barrier between the ice and our skin. But essentially, if we feel that there's been an inflammatory response, so by this I mean if you feel that you've suffered a muscle tear, a sprain to one of the ligaments, a damage to a joint, that is where we want to be using ice as quickly as possible for 5 to 10 minute periods. So I hope that makes sense in terms of this common question that I get, and I understand that it's very confusing for people. Should I use hot or should I use cold? Well, nice and simply, if you're preparing for exercise, preparing for competition, and you feel that the muscles are a little bit sore, a little bit tight, then yes, use heat, encourage a blood supply. I have this phrase that motion is lotion, and essentially there, if we're looking to get blood supply, get this to the area, that will create a lotion effect and will make us feel better. But be warned that we don't want to put heat around a source of inflammation because it's going to encourage that inflammation. So what we want to be doing, if we suspect a muscle tear or a damage to the injury, we don't put heat. This is when we use ice. This is when we use ice to act as our painkiller. So if we've suffered an acute injury and it's very sore, we can use ice, and also to reduce the amount of inflammation we're getting, to control the inflammatory response is how I prefer to talk about it. That is when we look to use ice to control that, and we should be using this for 5 to 10 minute periods and repeating that as much as possible in order to control that inflammatory response.